Okay, who remembers that tune? I don't, I was too young. And some of you are still looking puzzled, so it's whose line is it anyway? Do you remember that? Yeah, for those of you who don't know, people used to kind of give their version of a song, do a dance, act something out, and it was all their interpretation, bit tongue-in-cheek, of what's going on. So I'm going to talk about whose experience is it anyway. And I'm Joan Sadler from the NHS Confederation. The picture of Adam is quite moving, actually, because this work reminds you we're talking about real people who've got real lives, and some of them actually die. And the experience is cyclical. We're starting from birth through to life, through to death. And so your work, you know, it gets quite emotional, don't you think? I get quite emotional about some of it, and just watching Adam's rhyme about a key leader in the NHS who impacted his life, and they both impacted each other's lives. I'd love that for every member of staff in the NHS, every leader, to be really kind of emotionally connected to what we do, as well as being constructive and improving what we do. So I'm going to talk about a range of experiences. I'm going to use a little bit of the 5-year forward view to talk about those experiences. That's the key strategy for the NHS, kind of. So I'll refer to that strategy a little bit. The other thing about whose line is it anyway is that people were quite diverse in terms of their experiences. I'm not going to ask any of you to sing or act today. But if your phone goes off, is that okay? So whose experience is it anyway? The 5-year forward view, the only relevant bit of this busy slide is the bit at the bottom. It talks about, in order to make sure that we get to the strategy of a system of services that really responds to people across integrated services, we need 3 categories of people to be involved. The first category we're not talking about today, politicians, but we do need their say-so. The 3 we're going to talk about are the public, the NHS and its staff, and patients. So Simon Stevens, Chief Executive of NHS England, leading this strategy, talked about us having support from those categories of people, including patients and the public, if we're really going to make significant change. A patient's experience is impacted by all 3, their own, the staff who provide for them, the workforce who provide for them, and the public. So who are they? I would ask you, who do you think the patients, the workforce, and the public are in this picture? Any guesses? All of them? Okay, so I'll come back to it. But the public, patients, and the workforce. We've got some pretty dire news at the moment. And if we think about the patient's experience and what impacts on that experience, we've got really quite horrible headlines. So something about the junior doctors' strike, something about accident and emergency, and can we still get access at the rate that we need it to services, and then the whole issue of training for nurses, you know, worse headlines that we've had in some time. And actually, this isn't about the politics. This is about, from time to time, the NHS is in the headlines with some of the worst news. That's the context we find ourselves operating in increasingly over at least the last 10 years, even the last 20 for those of you who've been around. But we do know that the context you're working within is that despite that bad news, we've still got a lot of really happy, satisfied people who receive care in services. It's hugely variable, and that's a challenge. But the context is we still do some great work. We still know that people support the NHS and the care that we give. We still know that the NHS offers the best R&D, research and development. It offers some of the best services across the world. And in a sense, we're not paying at the point of the time that we need those services. So in effect, we've still got an NHS that is a national treasure. It's a national treasure. It's one of the things that still comes up at the top of any of the surveys that we have about the UK and what's best in the UK. So that's the context we're working in despite the headlines. Some people are still getting great care. Most importantly, today we're celebrating some of that great care, and I think Penn is doing a great job, as are you. So instead of looking at the downside, let's celebrate ourselves. Let's give ourselves a round of applause. I think we deserve it, don't you? And we need to keep that in mind when the going gets tough, as it invariably will. So people using services, their experience, it's kind of, when you're working in this job, it's a little bit like creative accountancy. Those rules are blurred on purpose, because they become a blur. There's so much. This was taken from NICE guidelines when they were developing the patient experience guideline. Bit old now, but it includes all those concepts about thematically, how do we understand the experience of people going through very complex services? How do we make sure we've got the right context of quantity versus quality? It's a minefield. There's a lot that you have to deal with. In turn, there are lots of organizations who also say, you better tick these boxes or else your work will not be counted. And sometimes those boxes are a little bit far away from what patients really want to see, and indeed their carers. So we're counting things that we have to count, and some of those invariably are the things that should be counted. Are people getting seen in time? Are we having our complaints go up or down? But sometimes it can feel a little bit box-ticky. And there are huge amounts of organizations who are challenging us. The good aspects of care, then, we need to make sure we're not missing. So invariably, am I respected? Do people care about me? Do I know that I am going to receive the appropriate care? Can sometimes get missed. Again, the guidelines that came from the National Quality Board around what good experience should look like included some of these comments, but they invariably get missed. Why? So patient experience, whose experience is it? Why do patients sometimes get a bad deal? I'd say they get a bad deal sometimes because the reality doesn't face the rhetoric. The reality is that someone will come in who is overstretched, who's working on a ward where invariably the numbers on that ward go from 8 to 16 patients in the space of 2 hours, 3 people phone in sick, and actually they've got to deliver these patient experience metrics. No excuses, but how do we support those people who are delivering that care so that the patient invariably gets great care and the respect that they are accorded, should be accorded? This issue of the NHS constitution and those notions of respect, compassion, improving lives, how do we keep that consistency? Because actually that's what we would want. It's a little bit of a difficult deal, I think. So how do we stay excellent, kind, responsive when there are all these pressures? Whose experience is it? I'd say that there's something about good leaders recognizing that the experience of patients needs to be valued, and the experience of staff. So a good leader will ensure great patient experience by looking at the doctors, the nurses who believe in themselves and have the confidence to change things. They'll support people to change things. It's quite a difficult task. Good patient experience, we know we need good staff experience. And obviously, we've had some writing about that from recently through the King's Fund work and Michael West. But again, easier said than done. Here's a chart that I found through the BBC, I think it was, and it talked about the record rise in dissatisfaction levels. Well, actually, it's a headline. There is a rise in dissatisfaction levels. And just to kind of read that a little bit, the very and quite dissatisfied group, which is the time it takes too long to get to a GP appointment, that's actually going to at least 55%, I think we're at now. People are not getting the appointments that they need to. And the other key issue is a lack of staff, 43%. Again, actually, are there really record rises? Don't we know all this? We do know this, but there's something about how we support people. So the experience that staff would say they have in that record rise is, I'm not getting the support I need to deliver that excellent support that patients need. So we've got to recognise the experience of staff and the experience of patients. Are we mapping both together? Even though we've got separate surveys, are we mapping both together? And I know Michael West has talked about how we try and start to do that. Again, figures telling us, this is a British Social Attitude Survey, 2015, the quite satisfied box, actually it's going down. The very and quite dissatisfied, at 23% for the first time since last 10 years at least. We're starting to see it going up. So again, how do we make sure that patient experience and the staff delivering that experience can be supported? Here's what Michael West says, and some of you will have seen this already. When we care for staff, they can fulfill their calling of providing outstanding professional care for patients. And what I've been really pleased to see is that in some of the submissions, you're really aware of that. You're starting to take on board this whole issue of patients and staff together needing the support. He also says in that last box, it demonstrates how good staff management offers significant financial savings for the NHS. So there's a care, we're getting better care when we care for staff, and we're getting the savings in resources that all of us would want to see. There's something about us being really quite clear about how the two work together, and nationally, where can we get the support to see both staff experience and patient experience working together. Interestingly, I'm going to just for a minute draw on the TDA work that they did recently to, it wasn't the TDA, sorry, it's NHS Improvement. They brought out some guidance that talks about how providers in this instance will deliver outstanding quality, access and finance. They're saying that we need to make sure that we're improving leadership and the engagement of staff. I think we're missing a bit of a trick because we need to engage people in that as well. So there's something about, as well as great leadership in the workforce, as well as technology and support from NHS Improvement, we actually need to make sure that we're engaging with patients and the public, or else again, we're on a hiding to nothing. So there's something about how NHS Improvement, it's been established to support providers, will also think about delivering outstanding quality, access and finance with a strategy that addresses patient and public engagement. And I know they're starting to do that. If we then think about whose experience is it anyway, so we've talked about patients, we've talked about staff, the experience of the public is an interesting one. The patient experience journey is affected by intrinsic and extrinsic factors closely aligned to the patients, caregivers, the workforce, and the public who fund to pay for that experience, whether it's good or bad. Hands up if you think the public think the experience of care in the NHS is good. Yeah, that's a majority of you. Hands up if you think they don't think it's good. That's the public. Okay, so we've got some hands here. There is quite a delineation in terms of what patients think and what the public thinks. Indeed, there's a consistent 15 to 20% gap in what people think. When I haven't got the recent figures, but I know at one time we had a 58 gap in terms of patients, the public thinking the NHS is effective, it's efficient, it's good. They were at 58% and patients at one time were at 75%. Yeah, I don't know what the gap is at the moment, but there is quite a delineation. Why? Because the public think a lot more about the efficiency factor, the resources, not just the money, how we're using everything in order to close this gap of better care. Patients, when they go in, we know they are happy, really quite satisfied with particularly the clinical care. So the public and their experience is quite important. And where are we measuring what the public thinks, along with patient experience and along with staff experience? Quickly to close then, the Health Foundation did some work a while ago. It was called Transforming the Dynamic. And they said you need 3 things to shift this philosophy, this culture that is needed for relationships that give a better framework for care. They said you need communities and the wider system having a relationship. You need better relationships between the person using services and the wider system. And you need better relationships between the individual and the clinician. So my premise, whose experience is it anyway? We've got to look at all 3, the public, patients, and the workforce. Lastly, back to whose experience is it anyway? I had the joy of knowing someone who was a taxi driver, and he's retired, but he was a taxi driver, and he told me this story. His wife went into intensive care. He was very, very sceptical of the NHS, going back to the public. He thought we all were, wasting a lot of money. Administratively, we needed to cut it in half and just be further efficient. His wife was in intensive care for 3 weeks, which many of you would know is quite a long time, very seriously ill, nearly died. She recovered, she's out of NHS care. 7 years later, he is still promoting the NHS as the best thing that's ever happened. Now, that's one person out of over 64 million of us. How are we harnessing those people out there who really want to work with us, to do the best for the NHS and to improve it? I think in the room, we've got some of you who have cottoned on to that. In the NHS, we need many more of you. So my congratulations to you for seeing the link. We've got to have the public on side as well as patients and the workforce, as well as those informal workforce like the carers. But we've got to do a heck of a lot more, and it's not about public health. It is about improvement and getting the public alongside with us. The last story I'll tell in terms of who these people are, so where did I get them? The top said were patients, the middle group were the public, and the bottom group were staff. But as you rightly said, there's no distinction, actually. They can be any one of those categories at any one time. How do we treat the whole person? My last story is about somebody who was involved in patient experience work. She used to come to all of our meetings. She was miserable. She was horrible to work with. Yeah, she used to complain all the time and give us a really hard time. And she was always in a hurry. She had some really great insights, but could be quite rude, could be quite horrible to everybody, and didn't have time for other people other than her agenda. Who was she? She was a patient who was a cancer survivor. She recently died. Corinne was somebody who was in a hurry for improvement. She sometimes was miserable because she'd been through her chemo. She sometimes didn't have the time for us as time wasters, because actually this was a matter of life and death. And for her, she wanted to see improvement. She was in a hurry for improvement. Why am I telling you that story? Because I'd like you to continue to be in a hurry for that improvement. We recognize that sometimes people we do work with can be quite emotional, can be quite horrible. But there's sometimes a reason for them wanting the best as we want the best. And so this patient experience journey, this staff experience journey, public experience journey has to be about better care and us working together in a relational way. As Don Berwick says, it's not just about the measurement. In fact, we probably need less measurement, and we need more about relationships. We need more about how we work together as a whole system, and we really need to listen to patients and to act. He said that in 2013, 14, when he did the report for us on safety. I saw Don Berwick last week at the King's Fund, the Improving Quality event, and he was saying the same things. And he looked a bit jaded. Do we look like that sometimes? We're saying the same thing all the time. I'd encourage you to keep saying it. This network is expanding. I'm really pleased to see that it is expanding, and there is something about you being able to improve. There are some references that are going to be in your pack, but I'll leave it there. I implore you, keep doing what you're doing. It's deserving. It's the best thing the NHS has to offer. And thank you for listening.
Good morning, Joan. Now pick up your phone.